Hi Vivian, thanks for coming in today. As you know, I'm Katrina Putnam. I'm currently an MSW student at Edinburgh University, and I am interning here. And as we've worked in the past together, I will be conducting like CBT session with you. Um, I know that you've been experiencing some high anxiety recently, and when you called to make this appointment, um, you sounded a little tense on the phone, and uh, I'd like to go over like what exactly is going on right now.
Yes, I do experience a lot of anxiety, and as you know, I haven't had a job for a few months, and I want to apply for jobs, but I feel like I don't have any qualifications to have a new job, and I don't know what to do.
Okay. So today, as I discussed earlier, we're going to be using cognitive behavioral therapy model. So when you're talking to me today, I'm gonna kind of gently interrupt you at times. So please don't take offense to that. And we're going to do a refocusing technique and try to refocus some of your automatic thinking regarding this subject, to try to maybe like little adapt the way you're thinking about things. And hopefully we can relabel some things for you and make you feel a little more at ease. Like as you know, like automatic thoughts kind of control our behaviors and our feelings, and how they're all intertwined, how we had gone over before, and like it goes into our core beliefs and and our intermediate beliefs as well. So the purpose for refocusing is to relabel and our thoughts and accept them, and experiencing them, but then also being able to tell ourselves, hey, I'm a little bit freaked out right now, but let me revisit this and kind of step outside. I'm having an automatic thought, and then you can try to relabel it. So that would be like your homework. We'll talk about that at the end of session today. So, all right, now if you could just go ahead and like tell me just a little bit about what's going on.
Okay. Well, I know it's been a while since I've had a job, and I know I need to have a job, but I'm just not qualified for anything. The last job I had for 13 years, and I know that the only reason I had it is no one wanted it.
Let me just stop you right there for a second. Okay, so I'm hearing that you feel like you're not qualified for anything, and the last job you had was because no one else wanted the job?
Right.
That had nothing to do with you.
Well,
could you name some things that maybe, you really contributed?
Well, I guess maybe. I guess maybe someone could have had it, but I didn't apply for it. I guess I was good at what I did, and I worked with children, and I was pretty successful at it.
It sounds really actually awesome. It sounds like you did some really good work. Could you like name a couple big accomplishments?
I worked with an agency with children who experience trauma, and I built up a couple of programs there.
Wow. So do you feel proud of these accomplishments?
I do. I feel like a failure because I burn out in the agency.
Let me stop for 1 second. Sometimes when we're in this field, burnout does happen, and it's actually kind of great that you recognized that burnout and said, you know what, like I need to kind of move on from this right now and step away.
Yeah, but I didn't move on. I quit, and I haven't gotten a job since then because I'm not qualified.
Let me stop you for again. Okay, let's look at your qualifications. Let's think about, where are you qualified? So you're currently in a master's program, and you're getting ready to finish up. Let's talk about like your experience that you have had related to this field. You talked about working with traumatized children and helping them through some tough times, and counseling them when in need.
But I don't want to do that anymore.
And that's okay.
Okay.
Let's think about some things that maybe you do want to do.
Well, I was thinking about, believe it or not, I like to work with the elderly. My past internship, I did that with transitional care. With a hospital, I really did enjoy that, but I just feel like I'm not qualified for that. I'm not qualified for that because I haven't done it professionally, and so many people have.
Okay, let me stop you for 1 second. I'm not trying to be rude. However,
Mhm.
I think that you perseverating on the idea of your unqualifications or whatever is kind of getting you stuck where you think, because I never worked in this, I can't do it because I'm not qualified.
Mhm.
However, do you ever think about how you are qualified? Can you rephrase can you name a couple things that show that you do have qualifications to do this?
Well, I worked in the social work field for 13 years, and I did intern in transitional care with um, the age population. I did do that, and I did it well, and I had good evaluations with the agency. So I I guess that makes me qualified.
Yeah.
In that way.
I definitely think so. I think it's probably a scary time because you're kind of shifting from what you're used to, maybe, and maybe that is making you have these thoughts of, these fear thoughts of coming out that are saying, I'm not qualified, so I'm not going to even try.
But I've never even put a resume together because the other job I had for so many years, I never even, I just got the job. I never applied for it. It was just kind of given to me.
Yeah, I know, but I hear you. But with that, it's actually kind of shows to me how strong of a person you are and how qualified you are if someone's going to seek you for employment without even applying. So that's a huge strength right there. Yeah. Like they obviously saw something in you that, was really great, and you've proven to do great things for them. So, and now that you want to shift careers, I don't think, I don't think maybe thinking about how unqualified you are is the healthiest thing for you at this time. Can you maybe rephrase why you're qualified? Like, can you say in one sentence how you would be qualified?
Wow, that's going to be hard. Let me see. I'm qualified because I was in the field of social work serving others for 13 years, and I am now successfully in the Master's of Social Work program, going to graduate soon, and I interned with the transitional care unit working with the senior population.
That's really great.
That wasn't easy. I didn't like doing it.
Well, I mean, I think maybe it might be a good idea to write that down as a reminder of yourself. And instead, when those thoughts come in your head of, I'm unqualified, I can't do this, maybe do the thought stopping where you stop and think, okay, why am I saying this to myself? And then pull out your piece of paper and say, oh, I am qualified.
It's easier to say I can't, though.
Absolutely. And I definitely can relate to that on some level as well. I remember feeling the same exact way as you are right now. Okay. It's a scary time. So, thank you for coming in. And is this something that you would be willing to work on?
I think so, even though it's really, really difficult. I think I can do it. Okay.
All right. That sounds like you, at least it's a small step, and that's all this is a one day at a time kind of method. We're all going to have those thoughts sometimes that make us, think negative thoughts and think things about ourselves, whether true or not. I mean, there's always some underlying truth to a little bit of it, but I think that, you're going to get yourself to a good place if we keep working on this. Okay. So to summarize, like what we did today is that we kind of stopped you in your automatic thought process and kind of rephrased things and showed where your strengths are. That was called the refocusing technique again. And with the gentle interruptions, thank you for being patient. I know sometimes that may feel, it kind of makes me uncomfortable at times, but it is necessary for the intervention. I hope that your anxiety levels come down in the next week. Give me a call if you need anything. Okay. I'll be here Monday through Friday until 5 p.m. And if you could just, I'll give you this homework to do, and at home, if you could just, by next session, could you just write down some qualifications that you do have and some strengths about yourself, and then we'll work on as you're having these negative thoughts, pulling that out of your purse and being able to read them back to yourself. As much as you may feel like it's cheesy or whatever, I get it, but it actually does help a lot. I've had to do this myself as well. So, all right. Well, thank you so much for coming in, and I look forward to our next session.
Okay, thank you.